So what I'm going to talk about now is musculoskeletal trauma. So I'm going to talk about the different types of musculoskeletal trauma we have. These includes fractures and dislocations and subluxations, but I didn't really write any notes for dislocations and subluxations, but you can Google that. I'm going to talk about the causes, the direct, indirect, and pathological causes of fractures, the different types of fractures and dislocations and the assessment that we have, and then we further into the management of these. So firstly, the different types of fractures that we can get. Um, what a fracture is a disruption in the continuity of bone. And these different types of fractures you can get collies, comminuted, compound, green stick, impact, oblique, spiral, and transverse fractures. So there's a few of them. I'm not going to delve into what they are exactly. It's just you just Google it and look it up. I'm not expected to know that, so too bad. I'm going to talk about the causes now. So we got the causes. We got direct, indirect, and pathological. A direct cause is from a blunt or penetrating force application to specific parts. So you want to get as much information out of these patients as possible. So if they've had someone, I don't know, someone's been hit in the back of the head by a tree before, that is obviously one of those ones. An indirect, so an indirect fracture cause is if you fall vertically, for example. You generally get spiral fractures from these. So if you've jumped off a 3 or 4 meter building and you land on your feet, you're probably going to get fractures up your legs. So it's generally might see spiral, but who knows? You can get a lot of different things in people, but that's generally the case outcome. And with this, you generally get fractures distant to the impact site. So if you land on your feet, yeah, maybe you might hurt your feet a little bit, but you might get a fracture up your leg. So that's what it's referring to there. The pathological conditions, so you've got malignancy and osteoporosis. So you think about the nana trying to climb a mountain and fell off a sorry, I don't know why. No, anyway, and neck of femur, the bones are weakened due to a variety of different causes. One of them is like women, for example, older ladies generally have a decrease in calcium or something like that. I've forgotten since 2 years ago, but anyway, not the point. So yeah, the causes are generally injury resulting from application of force. So fractures, joints, dislocations, and sprains and strains is generally the result of these. Furthermore, we've got dislocation and fracture assessment. So clinical features. What is a patient going to present with a fracture? That's what it's pretty much saying. Obviously, there's a lot of things like anxiety and high respirate, etc. But the clinical features of a fracture or a dislocation, you're going to have pain. No shit, you'd be worried if they didn't have pain, actually. Irregularity, so if, for example, a Colles fracture in the hand, does it look like this, or is it completely out of whack? You're going to look for that. Loss of function, so for example, with the Colles fracture, you'd want to get them to move their fingers. If they had a fracture up here, you want to move their fingers, and obviously it depends what field of medicine you do, because obviously it's a neurological function, or they're looking at tendons or something, I don't know. Just remember, I'm a student, so I don't fucking know shit. Swelling, deformity, tenderness, and crepitus. So they're the things that you're looking for. Tenderness is that obviously you're going to feel around, and you're going to note these things. So noting these things is not just for you, it's for the hospital, because when you hand it over, you're going to say, this is what the patient presented with. So it gives the nurses and the doctors something to compare with later. And this is also, you write this information down on the VACUS, or if you're looking not in Australia or Victoria, the information you write down is obviously collated, and then you've got research that comes off that. So you want to really figure out what's going on, and you really want to write it down. This just makes a thorough patient assessment, and you have your ass saved because you haven't missed anything. For example, if there's loss of function that has happened a certain amount of time after the fracture or something like that, there is maybe the answer to what's going wrong with them. For example, let's say they don't have any pain, and you just assume they have pain, you give them pain relief. If they don't have any pain, that could be the answer to what something else is going on with them, if that makes sense. It makes sense to me. Danger signs. These are the things that you need to be worried about. So, for example, pallor, you've got pale skin. So pallor is pale skin. You've got with you can tell this by just the skin color and by the capillary refill, the nail bed. Um, Paresthesia, so pins and needles. You have to ask the patient these. You don't expect them to tell you this because they're oblivious to what's going on. Like they're in stress. They want some pain relief. They're not going to be like, okay, my name's Aaron White. I'm a 34-year-old male. I'm not 34. I'm currently presenting with paler skin, pins and needles. It just doesn't happen. You ask them. So decreased capillary refill, pins and needles, pulses. Are they dismal or absent? So again, you've got to check. So don't just expect them. Paralysis, so inability to move. So you don't assume that that's going to be all sweet and dandy. So you've got to think about the injuries to the surrounding underlying organs. So bone fractures. So don't just assume that they've got a fraction that's anything that's wrong with them, because you could, for example, break a collarbone and this could give you a pneumothorax because the actual bone is poking into the pleural space. So you've just got to remember that just as they're presenting may not be the only case. So they might have bones sticking into their liver and such, which can cause a lot of different problems. So you want to assess this and make sure some actual specific injuries that you need to be aware of. Fractured clavicle, again, aware of the pneumothorax. A fractured humerus, so don't stick an IV in that arm, no shit. I said that in the burns thing. You'd be surprised. I've seen someone doing pneumothorax chest compression on the wrong side. So that's just fractured collie, the fractured femur. So just remember for blood loss. And what was the force? And a fractured noff. Foot on the affected side can be a lot shorter than the other leg, and it can be on an angle. So that's obviously, as a paramedic, people. I'm a student. Paramedics will learn over time how patients present, and a person like an old natter with a noff foot on the affected side is going to be shorter than the other one. The leg, sorry, is going to be shorter than the other one, and it's going to be twisted. So principles of splinting. So what is the principles of splinting? The principle of splinting is to immobilize the injured body part. That is what we do. That's what we want to do. That's the principle. What does it do? It alleviates pain, minimises further damage, allows easier transport of the patient, and ensures good perfusion below the injury. So if you fractured your leg, your foot's going to get a decent amount of blood supply, and you're not going to kill the tissue off there. And that goes back to the danger signs. If they can't feel anything down below, you do a neurological assessment, they can't feel anything down there, you really don't know what's going on. You've just got to be really systematic in your approach. And just finally, amputation, avulsion, and oh no, I didn't write that. So amputation. What is an amputation? It's an accidental severing of the body part, partial loss of limb or body part with some soft tissue remaining, maybe. The management of this is chuck the leg, foot, and whatever's decapitated or whatever into the plastic bag. Well, maybe not decapitation, because that's just stupid. Because you can't really. Well, it's not stupid because you got to pick them up anyway. But it's whatever. Avulsion, it's forcible tearing away of the body part, skin and bone as well. Management, you place the tissue in the normal location if it's possible, and check your neurological and vascular status. So that just goes back to basics. Could be out of the scope of what you're looking for, but yeah. Just notes. Some notes done here. Dislocation. What is a dislocation? It's a normal articulating ends of two or more bones which have been displaced. So you think about a dislocated finger. You've got this bone and you get this bone separated, not together. It's displaced. Subluxation, partial dislocation of articulating status of a joint, surfaces in contact and aligned, maybe normal. Maybe ignore what I just said because that doesn't make any sense to me. Yeah, so that there is pretty much musculoskeletal trauma. Obviously I didn't go into depth about the different types of fractures you can get, but look it up, then you'll be right. I'm sure there's plenty more videos about that, but yeah, anyway, cool. Have fun. See ya.